It was a day in April 2012. I had been sent to attend a training session organized by our superiors. A head nurse was sitting behind me. During lunch, our conversation somehow turned to paranormal incidents that had taken place in hospitals. The head nurse then shared something she had experienced personally. She said that when she first started working at the hospital, she had been relatively lucky. For about 6 months, not a single patient died during any of her night shifts. Then, one night about 6 months into the job, 2 patients died during the same shift. After that, it was almost as if she had been cursed. Every night she worked that week, at least 1 patient died. Over the course of 5 night shifts, 7 patients passed away. The staff eventually noticed something strange about one of the rooms where a patient had died on that first night. The call bell beside the deceased patient's bed kept going off, even though the bed was empty. At first, everyone assumed there was a faulty connection. The call bell sometimes went off during the day as well, so it did not seem particularly unusual. The staff continued admitting patients and assigning them to the available beds as normal. But no matter how stable a patient had been, once they were moved into that particular bed, their condition would deteriorate very quickly. 2 more patients died in that same bed. After discussing the situation, the staff decided to move the healthiest and most stable patient in the room into it. They did not have much choice. The hospital was crowded, and they needed every available bed. Within a week, that patient began suffering from respiratory failure. The head nurse at the time immediately ordered everyone to be moved out of the room. The door was locked, and the room was taken out of use until they could decide what to do with it. Sometime later, the nurse was working another shift when the call bell from that locked room began ringing again. It happened during the day. She and one of her colleagues assumed that the cleaning woman had entered the room and accidentally touched the call button. The cleaning woman had a key, since the room had been kept locked. The 2 nurses walked over, unlocked the door, and went inside to silence the bell. Only then did they notice the layer of dust covering the floor. There were no footprints and no sign that the cleaning woman, or anyone else, had entered the room. The 2 nurses looked at each other. Then they turned and ran.